As widely reported, here in the United States and abroad, Actos, a popular drug to treat type 2 diabetes, has been linked through clinical studies to an increased risk of developing bladder cancer.
Hello, I'm Howard Nations. The purpose of our video today is to talk to those of you who may have taken Actos. We want to tell you the current status of the Actos litigation, the dangers involved in an Actos injury, and most particularly, the things you should consider in hiring a lawyer to represent you in your Actos case.
This drug, sold under the brands Actos, Actoplus Met, Actoplus Met XR, and Duotact by Takeda Pharmaceuticals, contains Pioglitazone, a prescription drug of the class TZD, or thiazolidine-dione, which demonstrates hypoglycemic, or low blood sugar, anti-hyperglycemic high blood sugar, and anti-diabetic action. Millions of Americans have been diagnosed with type 2 diabetes. When a person eats food, the body breaks down all of the sugars and starches into glucose, which is the basic food for cells in the human body. Inside the pancreas, beta cells detect rising glucose levels and release insulin into the bloodstream. Cells in the body have receptors that bind to insulin, which then acts as a key to a lock to open up cells so the circulating glucose can enter. Cells use glucose to produce the energy needed to function properly. Without adequate levels of insulin produced in the pancreas, or when it is rejected by the cells, glucose builds up in the blood and can lead to diabetes complications. In 2010, these pioglitazone-containing drugs were prescribed to over 2.3 million people and became the most popular pioglitazone drug on the market and the 10th best-selling drug in America. This occurred after the FDA considered pulling Avandia, manufactured by GlaxoSmithKline, off the market, which was Actos's chief competitor. With its widespread use and popularity, recently, pioglitazone has been associated with life-threatening side effects. In Europe, both France and Germany have withdrawn pioglitazone products from the market because of safety concerns. This action was based on a clinical study conducted by the French National Health Insurance Plan, using 1.5 million diabetic patients treated with pioglitazone. The results of this study showed that pioglitazone treatment for over 12 months carried a 40% increased risk of bladder cancer. However, the study stated the risk of shorter-term treatment, less than 12 months, causing bladder cancer cannot yet be excluded. Another study in the U.S., performed by Takeda Pharmaceuticals, the drug's manufacturer, following 193,099 patients at Kaiser Permanente over 10 years, found that with Actos, there was an increased risk for bladder cancer, a 60% increase after 24 months of use and 80% after 48 months. In the United States, these alarming findings, coupled with its own investigation, led the FDA to issue a safety alert and order that warnings be added to the labels of all pioglitazone medications. The mandatory warnings acknowledge the increased risk of bladder cancer, a risk which increases with longer duration and higher doses. Quoting the FDA Alert, the U.S. Food and Drug Administration is informing the public that use of the diabetes medication Actos, pioglitazone, for more than 1 year may be associated with an increased risk of bladder cancer. Information about this risk will be added to the warnings and precautions section of the label for pioglitazone-containing medicines. The patient medication guide for these medicines will also be revised to include information on the risk of bladder cancer. The FDA advised doctors to avoid using pioglitazone in patients with active bladder cancer and to weigh the risks and benefits when there is a history of bladder cancer.
The manufacturers of thiazolidine-dione drugs have strengthened warnings about the risks of heart failure with these medications, which are used to treat type 2 diabetes.
In 2009, the FDA required Actos and other drugs containing pioglitazone to carry a black box warning because they were associated with an increased risk in heart problems, especially for people with a history of heart failure. Now Actos has been linked to bladder cancer. The National Cancer Institute reported that in 2010 there were 69,250 new cases and 14,990 deaths. Diagnoses in patients, on average, occur at 68 years of age, and the major risk factors are environmental as opposed to hereditary, such as smoking and chemical exposure. Inside the human body, the urinary system involves the kidneys and bladder. Urine forms in the kidneys and flows to the bladder, which is a hollow, balloon-shaped muscular organ. Urine collects in the bladder until it is expressed through the urethra to outside the body during urination. One of the factors associated with bladder cancer is that urine can be held in the bladder for hours at a time, and its contents, when harmful, can chemically interact with bladder tissue. Looking at the bladder's structure, its wall is layered. The urothelium is a thin layer lining the inside. Then there is the lamina propria, which is loose connective tissue, then the bladder muscle, and finally a layer of fat. Bladder cancer occurs when healthy cells begin to grow at an unusually fast rate. This happens because the cells have developed the ability to divide sooner than they're supposed to. This increased tissue growth produces masses, or tumors, that, when malignant, continue to grow uncontrolled. There are 4 types of bladder tumors. First, there is small cell carcinoma, which is an extremely rare form of bladder cancer that can occur in any part of the bladder. Then there is transitional cell carcinoma, or TCC, which appears in the innermost tissue layer that lines the bladder. Another is squamous cell carcinoma that originates in the lining of the bladder but grows differently. And there is adenocarcinoma, which forms in the glandular or secretory cells. Generally, there are 2 diagnoses for transitional cell carcinoma: superficial, which is confined to the lining of the bladder, and invasive, where the tumor has grown, penetrates the layers of the bladder, and invades other organs and lymph nodes. The most common warning sign of bladder cancer is hematuria, or blood in the urine, which may or may not be visible. Other symptoms may include change in bladder habits, including having to urinate more often, an urgent need to urinate, or burning when you urinate, needing to urinate but not being able to, difficulty initiating or stopping urine flow, abdominal pain, loss of weight or appetite, and persistent lower back, upper thigh, or pelvic pain. If you are experiencing these symptoms, please contact your doctor for an evaluation of your risk of bladder cancer. Testing includes a CT scan, urinalysis, internal exam, and IVP, intravenous pyelogram, a cystoscopy, biopsy, or urine cytology. A prognosis is based on the stage of the cancer, the type of cancer, and the patient's age and general health.
If you feel that you've been injured through the use of Actos, then you're going to have to hire a lawyer to represent your interests, because obviously this is not something you can handle on your own. And it's very important for you to understand that you have to hire a pharmaceutical specialist in order to prosecute your case.
At the nation's law firm, our practice in pharmaceutical litigation stretches across the country with clients in all 50 states. Howard Nations is a renowned trial lawyer, a member of plaintiff steering committees in pharmaceutical litigation, recognized as a super lawyer who has been elected president of national and state trial lawyer associations and lectured to trial lawyers in all 50 states and 12 foreign countries. Mr. Nations has received numerous awards over the decades: the Warhorse Award, the Melvin Belli, and Clarence Darrow Awards. Mr. Nations and his staff of attorneys, paralegals, legal assistants, administrators, and trial support work applying experience, expertise, and financial resources to successfully resolve your case. Do you or a loved one suffer from bladder cancer? Do you or someone you know suffer from physical symptoms that might indicate cancer? If you have been prescribed medicine for type 2 diabetes, chances are that at some point in time you took a drug containing Pioglitazone. Check your medicine bottle and your written prescriptions. Contact your doctor or your pharmacy to find out if you have ever taken Pioglitazone. At the nation's law firm, we prepare Actos cases, client by client. In this type of litigation, known as mass tort litigation, it is not a class action suit, where a group of claimants, sometimes in the thousands or tens of thousands, divide a sum of money. This litigation is what is known as an MDL, multi-district litigation, where all of the cases nationally are consolidated in one federal court, located somewhere in the country. The litigation for the plaintiffs is guided by a plaintiff's steering committee. In a lawsuit, the plaintiff first proves liability. Who is responsible? In a court of law, that is a costly undertaking, in the hundreds of thousands of dollars. In an MDL, those expenses are shared among all of the plaintiffs, resulting in a low cost to each plaintiff, making a claim even possible. After liability is established, then each case, each individual is considered in terms of damages and the amount to be paid.
We look at your case individually, we pull together your proof individually, we present it individually, we argue it at mediation individually, and we settle your case individually.
Do you feel you might have an Actos claim? Our firm offers a free evaluation.